It's been 2 weeks since my bilateral knee reconstructions, and I'm here to set you up on a couple things that you can do to prepare should you try to do this procedure, okay? First thing you're gonna need, ice bags. Definitely gonna want those when you get home from the hospital. I would suggest wrapping a towel around the affected area, your knee. I would suggest put this on top. These cost about $8 on Amazon. And an ace bandage with Velcro, not those stupid metal things, but the Velcro. They make it very easy to keep the ice bag steady on your knees. And that feels so good after the surgery, after doing a workout, whatever. 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off. Do that for an hour, you're gonna feel much better, okay? The other thing I'm gonna suggest that you buy, got the ice bags, $8 a piece. One of these. You'd be amazed how some people are not very limber. I'm pretty lucky, you know, I'm limber. I can bend down and touch my toes. Some people cannot do that. These will help you put your pants on. They'll help you pick up something if you dropped it. For instance, your ace bandage or a pillow in your bed. Very good to have. What you are also going to need is a walker. This costs about $38 on Amazon. Snaps into place. Very, very, very comfortable walker. It's height adjustable, so even if you're Shaquille O'Neal, you can use this. Easily folds down. Make sure it is locked before you use it, and stows away pretty easily. If you have stairs in your house, you're going to want at least 2 walkers. One at the bottom of the stairs, one at the top of the stairs, if you're operating on 2 levels. In this house, we are doing that, so it was very helpful for me to have a walker on each level and an adjustable cane. Okay, so once again, going down the stairs, pretty important to be able to do this. I suggest getting 2 walkers, one for each level. Use a handrail and use your cane for balance if you want. I kind of don't need it now because I've done the work. But if you have one of these at the bottom of the stairs, quite good for you. This is pretty simple. It's aluminum. You get them for like $27, $20 if you're lucky. Just a simple push button to adjust the height. It's got a nice soft handle, which for some people who don't have the leg strength to lift their legs, they use this to put it under their heels and lift their legs with it. Okay, I didn't really need it that much for that purpose, but it is very, very helpful. The other thing that you're gonna need, you're not gonna be able to shower for a couple days, so I bought these rinse-free bath sponges. They're pretty simple. They're made out of a kind of a polyurethane foam or something, right? You wet it and it foams up just by rubbing it. Do your whole body, everything you need to wash. Get some help if you want, that makes it more fun. And then you just dry off. You don't need to rinse. That's the advantage of these, okay? So the rinse-free bath sponge is a good idea. You're not gonna be wanting to jump up and down too often when you've had your knees replaced. So I suggest these when you have to urinate. There's one thing you should know. These have a glow in the dark top, so it helps you find them when it's dark outside. But one of the things you're going to be on is pain meds after they do this, because it's an extensive surgery. It causes a lot of trauma. You're going to want to take your pain pills. They've got me on oxycodone for the first couple days. Problem with oxycodone and most opioids is it affects your intestines. I've said it can cause biblical stoppage. So you're going to want to eat roughage, and you're going to want to take Colace. That's a stool softener. It makes things flow a little bit. Very helpful. But when you use pain meds, just like it can do a biblical stoppage on your intestines, it also kind of takes you out of touch with your bladder and your Schwanzicle or whatever unit you're carrying down there. You could think you're done peeing and you're not. Give it a second. Otherwise, you'll have a mess and have to do a load of laundry, which I did. Very convenient. These came in a package of 2, I think, for like $15 or something like that on Amazon. Glow-in-the-dark pee bottles. You'll remember Mel Brooks in History of the World when he kept calling the piss boy. Okay, maybe you could get somebody to have that distinction in your house. You have to manage your pain when you're doing this. They say, think of pain as an uninvited guest. It is easier to keep him out than to get him out once he's in your house. I'm sure you've had one of those in your lifetime. Like I said, they give you oxycodone, usually to deal with the pain. I was taking 2 every 4 hours for the first couple days, and it managed it. I was still feeling some pain, but it did manage it. It helps you heal. It takes away the stress of having that pain. So use this judiciously. Listen to your doctors. Don't be a tough guy, because it doesn't help. It really doesn't. The other thing they're going to most likely prescribe after surgery like this is they'll give you baby aspirin, 81 milligrams of baby aspirin. Take 1 in the morning, 1 in the evening, just twice a day. It lowers the risk of stroke. You want to thin your blood a little bit, because once they get in there and they're cutting and they're putting a tourniquet on, you've subjected the blood to a lot of abuse. You want to keep it running smoothly. You don't want a stroke, okay? You got enough to deal with knee reconstruction. What's the other thing? Ambien. I was having trouble sleeping, one of those at night, but not too close to your oxycodone. Oxycodone slows your breathing down. You don't want to slow it down too much, all right? So be really judicious with that, only if you need it. Sleep and nighttime activities were the hardest for me. During the day, I could work out and I could accept the pain, but at night, when you're trying to sleep and you move the wrong way, you're gonna get jolted. So pay attention to that. The other way to manage your pain is with, I'd suggest at nighttime, Tylenol PM. It helped me rather than taking an Ambien. That's a good idea. Regular Tylenol, extra strength. Also, you can change that up with a little Advil if you want, which is a different ibuprofen, which you can work in conjunction with that. It's going to take care of you. That's all I can tell you. This is all possible. I mean, look at me, man. This is 2 weeks to the day since I had my surgery, and I can walk, I can stand on one leg, I can go up and down stairs without too much difficulty. Another thing you're going to want to get before you have this surgery is a toilet extension. Makes it a little bit higher, so you don't have to get down so low. You know, you don't have to bend that knee quite as much the first couple of days. I really, really recommend that. Okay, this is the toilet extension I was talking about. Your toilet seat, pull it off of your commode, put the extension on. This is called a Carex. It looks like it's about maybe 4 inches tall. It just gives you enough to deal with. There are bolts that go down the bottom. They fasten with a wing nut in the bottom of your commode. You can bring your walker in here, get it back here, get your hands nice and supported, lower yourself down, and all is right with the world. Okay, these handles are pretty good. The only problem with this for shorter people is that your knees will not be able to bend this much after surgery. So you're going to want a little stool. This was really inexpensive. It's about 6 inches tall, 7 inches tall. Get it out there in position so you can move it with your feet. You might have to use your hands to get your legs up there at first, but it's much more comfortable. All right? And that's what this is all about. Getting through the pain, healing. Here you are. All right? I'm just telling you, folks, I did it. Don't compare yourselves to me. Don't compare yourselves to anyone else in this process. It's up to you to feel your body and adjust to your own healing. The other thing I would say, after the surgery is all done and your scars are starting to heal, I bought this advanced scar gel by Nuvadermis. Okay, this is just one brand. There are salves for healing your scars and painting them. A good idea, especially if you want to keep your legs in good shape. That's all I got for you, folks. I hope this has helped you, and I hope I can serve as some kind of inspiration for somebody. I am so glad I did this. My life was really not fun with my bone-on-bone knees. This has got me thinking about golf in maybe a month and a half, 2 months, something like that. It's on the horizon. Where before the pain was a rabbit hole that was just going further and further down, the pain after surgery is one that has an end. And the ending of that pain is the beginning of your new life with reconstructed knees. All right, good luck everybody. Thank you. Peace.